You have a migraine, or rather, a migraine has been diagnosed for you, or you suspect that you have a migraine. You suffer from a headache in half of your head. You have nausea, vomiting accompanying the headache. You find it hard to tolerate bright light, loud sounds during a headache attack. These are all signs of a classic migraine. There is such a questionnaire, ID migraine, and I just gave you the questions from this very test. You've been diagnosed with a migraine, and not with the help of an MRI, ultrasound of the blood vessels of the brain and neck. I always speak out about this, that a migraine is a clinically based diagnosis based on a person's complaints. How to treat a migraine? The first thing we start with are not pills, but eliminating trigger factors. Many of you who suffer from migraines know that the onset of a headache attack is associated with the consumption of red wine, chocolate, following sleep deprivation. You should give us as much detail as possible about what triggers the development of a migraine. What should we do next? You can use common so-called simple painkillers, maybe paracetamol, or combined drugs. Over months or years of your life with migraines, they stop being useful. The next step in migraine therapy involves using triptans or non-steroidal anti-inflammatory drugs. I won't elaborate on triptans for now, but I will caution against taking them too frequently because you can only use them twice in 1 week. If you do it more often than that, you will surely develop a dependence on the pain. If neither triptans nor NSAIDs provide relief and you figured out your triggers, then you might ask what else you could do. We can go different ways here. The first route is monoclonal antibodies. Currently, in the Russian Federation, there are only 2 drugs on the market that we can use for preventative treatment of migraines. I want to emphasize right away that these monoclonal antibodies have proven their effectiveness and safety over several years of clinical trials. As of now, in the Russian Federation, we are gathering experience using these drugs. I can say that in our clinic, we have been actively working with them and seeing how well they work. But there is a problem. They are expensive, at least 20,000 rubles. Yes, the injections are once a month, subcutaneous. But they're still expensive, and you have to inject them for several months in succession for good clinical effect. But it's worth it. Besides monoclonal antibodies, there are cheaper options, like anticonvulsants and beta blockers. But they should only be used under medical supervision. You can't take anticonvulsants, topiramate, or beta blockers indiscriminately. Side effects need to be considered, as well as your social, physical, and psychological activities. If your job involves spending a lot of time driving or requires you to always have a clear head, sometimes we have to say no. So we switch from this effective method of migraine prevention to beta blockers, but we select the dosage of the medication individually in every case. That means there's no single standard dosage of an anticonvulsant or beta blocker that would fit everyone. There are so-called non-drug neurostimulation techniques. One of them is available in Russia, known as the Cephaly method. Once upon a time, you could purchase a Cephaly device on the internet. Now you're likely to find them only in specialized clinics. You first attach a special electrode to your forehead, then put the device on, press a button, and thanks to this neurostimulator, which generates a pulse of a certain frequency, a migraine attack or practical migraine treatment is mitigated. Most importantly, if you suffer from migraines quite often, avoid self-medicating. Always consult with a doctor to determine the sole possible treatment plan for your specific scenario. Stay healthy, take care of yourself, and live without pain.